Good afternoon, Joe Roble here, once again back with Dr. Newhaven of Northwest Indiana Chiropractic. And today Dr. Newhaven is going to talk about TMJ. Good afternoon, Doc. How are you?
I'm doing well, Joe. Thanks for having me.
Excellent. Glad to be here. Why don't you tell good people exactly what is TMJ and what causes it?
Well, TMJ, or temporomandibular joint, is actually essentially your jaw joint. And a lot of people have dysfunction of the way that joint works. So, for instance, if you have clicking or grinding when you open and close your mouth, if you get any kind of jaw pain or trouble chewing, all those things could indicate that you might have temporomandibular dysfunction or TMJ problems. There's also other headaches are very commonly caused by TMJ problems. Even eye pain, ringing of the ears. Also, musculoskeletal research shows that about 50% of neck pain and headaches actually has a jaw component as well. So we're not saying that the jaw always causes the neck pain, but a lot of times it is a driver or a component, a part of that, the overall neck pain condition. So, there are a lot of reasons people can get TMJ, Joe, or different kinds of dysfunctions here. One of the most common is clenching and grinding. We live in a very stressful society, and the jaw and the muscles surrounding the jaw are actually one of the first places that mental and emotional stress show up. So, for instance, if you're having a real stressful time in your life and you start developing headaches, more than likely it could indicate that you're clenching and grinding. And so that's a real common one. I always tell my patients, if you clench your jaw, you also clench your neck. So just something to be aware of and to try and be conscious of. Another common thing that happens is after any kind of trauma or even braces. So people get rubber bands, and a lot of times what the body will do is when the rubber bands are trying to pull you one direction, the body will resist and the muscles will try and actually push you the opposite direction.
Wow.
So after any kind of dental procedures, braces, anything like that, you can actually develop a TMJ type of an issue, Joe.
Wow.
And there's just, there's a lot of different causes. Those are just some of the most common causes.
Well, that's interesting. I know a lot of people experience it, my sister being one. What are some of the treatment options in some ways to alleviate the pain or correct the issue?
Well, there's not, this is one of the problems with TMJ. There's more and more literature and research coming out now about good treatments. And really, any good treatment is going to assess the function of the jaw. A lot of people, I work with a lot of dentists in the area, and I get a lot of referrals from dentists. And the most common dental procedure is actually a night guard or a mouth splint, which basically treats the structure of the way your joint is aligned at night. Well, what happens during the day when you're opening and closing your mouth, you're talking, you're chewing? Most people aren't wearing the night guard then. So what you want is a program that combines good treatment of the structure, aka a mouth guard through a dentist, but then also a way to treat the function of how your jaw is functioning or moving throughout the day when you chew, when you talk, and things like that. So you want somebody like myself, who's a chiropractic physician and very well versed in the musculoskeletal system, that can address the way that jaw is functioning. I found through my experience that when you combine the structural treatment with the functional treatment, you just get so much better results than when you try to do one or the other, which is why a lot of dentists refer to me, because their patients just get really good, quick results. And just a couple ways to kind of determine if you think TMJ is an issue for you. Obviously, if you have clicking and pain, that's one major indicator. Another one is if you actually look in your mirror when you brush your teeth. I just want you to line the middle of your nose up with the middle of your jaw, and you can even put your finger here, and watch what happens when you open your jaw. Does it go straight, or does it go to one side? Like that? Or like this? Or does it snake like this? Either of those also indicate a muscle balance. So if you think about it like a pulley system, well, if one muscle is too tight, it's going to do what? going to pull you to one side,
Right.
which could create which means that's a sign of dysfunction. Another really common sign that I see is actually when people do this a lot. So they'll open their mouth like this, or it'll just be kind of a bad habit that people do. They kind of grind their teeth, or they stick their chin out like that. That's another sign that you could have some kind of a jaw dysfunction. So, and some there are a lot of treatments out there for that. Like I said, the mouth guard or the night splinting is one, but a lot of times that's just going to protect your teeth and change the structure a little bit. Good functional treatment of the jaw will include some kind of manual muscle work, such as some muscle work inside the mouth, like I do in my office. It'll include some trigger point work. So, if those of you who don't know what a trigger point is, it's kind of like a hot knot in your muscle. So, you have a knot that is a little tender, or maybe more than a little, real painful or tender when you push on it. That's essentially a trigger point, and those can cause headaches. And I've had lots of patients in my office come in with headaches, and I'll find a place in their jaw, and all of a sudden they're like, oh yeah, that's creating my headache. That's essentially a hot knot, and that's stuff that we can treat with different techniques. You could also, any good jaw or TMJ program is going to have some rehab exercises for you to do at home to start working on the way that jaw is functioning, the way it's opening and closing, the way it's moving when you chew. So you want that combination approach to really assess and address the function.
Wow, that's interesting.
Yeah.
Just like anything, you've been having such a bad habit for many years. It's going to take some work to correct that. So.
Absolutely.
Are there any quick tips or maybe some things that you might be able to do at home to help alleviate the pain or help?
Yeah, absolutely. One of my quick tips I would say about 50% of people who clench and grind have no idea they're doing it. It's just a subconscious habit that they just don't even know.
I'm a bit of a grinder myself.
Yeah, some people like some people they don't. So what I recommend people is set an alarm on your phone for every maybe 2, 3, or 4 hours, and every time that alarm on your phone goes off, think to yourself, am I doing anything bad with my jaw? Am I clenching? Am I grinding? Am I chewing gum? Gum is not something I recommend people chew on. It causes too much activity of the jaw muscles. Are you doing what's called tongue thrusting, or pushing your tongue against your teeth or against the side of your mouth? Are you chewing on your lip? Are you chewing on your gum? Those are all bad habits that can create jaw dysfunction. So every couple hours when that alarm goes off, just stop and think to myself, am I doing any of those things? And if you are, stop. The first stage to making any kind of change in the jaw is just conscious awareness of when you're doing something bad, and then an instant correction when you are to something a little bit better. So that's, I think, one of the easiest things for people to work on. Now, is that going to fix all your jaw problems? No, but that conscious awareness is a very important step, and it's simple for most people to do.
That's a great tip that could probably apply to many bad habits people do. So.
Yeah, absolutely, absolutely.
That's excellent. So, Dr. Newhalfen, thanks again for giving us some great information, and tell the great people how to find you if they have any questions.
Well, you can give my office a call to schedule an appointment at 219-322-6942. I have offices in both Cherville and Crown Point, Indiana, and you can also visit me on my website at nwichiropractic.com.
Excellent. Thanks again. Thanks for watching.
Thank you.
And we will see you next time.
Take care.